So parasitic infection of skin and soft tissue musculoskeletal system. We are handling with dracunculiasis. It is a parasitic infection by somatic nematode Dracunculus medinensis. It is which causes guinea worm disease or dracunculiasis characterized by cutaneous blisters. It is endemic in 187 countries, including India, and in 1986, 3.5 million new cases were occurred, and in 2019, only 54 human cases were reported. Next, coming to the life cycle. Life cycle, we will finish with the diagram. So first, you can see that man is a definitive host and a cyclops is an intermediate host. There are two hosts, definitive host and intermediate host. Definitive means in which the sexual cycle occurs, and inside intermediate means asexual cycles. Definitive host is man. Man occurs the infection by consumption of water containing infected cyclops harboring third stage L3 larva. L3 stage larva is infective form which comes from the cyclops, and man eat that cyclops which are infected, and that cyclops which are digested in the stomach release the L3 stage of larva. This L3 stage of larva penetrate the small intestine and migrate to the thoracic muscle, and in the thoracic muscle molting occurs, and those larvae converted into the adult male and female worm, and there is after sexual maturation the gravid female worm migrates throughout the body, and in the skin when in and they also come in the skin. When the skin comes in contact with the water, there is a blister formation, and that blister will rupture, and the larvae are released into the water. That larvae are L1 stage larva, and that L1 stage larva will be taken up by the cyclops, that which is a intermediate host, and these larvae are motile and free swimming. Cyclops are the crustaceans, and the L1 stage larva molts 2 times and converted into L3 stage larva in the cyclops, and this cyclops will be eaten by the man, and the cycle continues. In pathogenesis, signs and symptoms appear after 1 year after the infection, when the gravid adult female emerges near the surface of the skin. When the skin comes in contact with the water, there is a painful blister formation, and the female worm emerges accompanied by the local erythema and fever, nausea and pruritus. The most common sites are leg, ankle and foot. Secondary bacterial infections may occur after the blister site. Secondary bacterial infections means once the blister ruptures, there may be chances of getting infected by other bacteria, and there will be local infections, that is secondary bacterial infections. When here you can see in the diagram, there is a blister formation in the leg. This is from Apurva Shastri Ashok, Essentials of Medical Microbiology, Dracunculiasis topic, which causes guinea worm disease. Here you can see the blister formation in the first diagram, and from the second diagram you can see a person is removing the parasite from a leg or from a blister, that is a female parasite. Here the female parasite is removed, not the male parasite. Laboratory diagnosis, we can detect the adult form. The gravid female worms appear in the blisters. Gravid female, maybe the parasites are dead, and if the parasites are calcified, we can detect them in X-rays. Next, the detection of L1 stage larva. When a person places his leg in a cold water, there is a formation of blister, and that blister ruptures and L1 stage larva are released, and those are motile, and these L1 stage larva can be seen. Next is antibody detection. Antibodies to Dracunculus medinensis can be detected by ELISA, enzyme-linked immunosorbent assay. Peripheral blood smear eosinophilia. Eosinophilia means increase in the number of eosinophils, which is seen in allergic and parasitic conditions. Next, coming to the treatment. We can do worm removal for 15 to 20 days, and the heavy pressure should be avoided, because if the breaking of the worm occurs, there will be an allergic reaction and secondary bacterial infection. If while the person is removing, if that worm ruptures, there will be secondary bacterial infection. Next we can do the symptomatic treatment, that is wet compression. Wet compression is we can apply some wet on it, and next is we can use analgesic, which is a painkiller, and to avoid secondary bacterial infection, we can give some topical antibiotics, and no anti-helminthic drug is found out for dracunculiasis. This dracunculiasis is reasons for eradication from India is National Junior Worm Eradication Program, which was launched in 1984, and with technical assistance from World Health Organization. In that, the cost-effective measures were taken, that is a provision of safe drinking water, the water were filtered, and the installation of hand pumps and pipes. And cyclops were controlled by killing the copepods in the surrounding water. And provision of clean drinking water from the borewells, health education for boiling and filtering the water, and treatment of cases. Always prevention is better than a cure. Here Dracunculiasis topic ends. See you in the next video. Tab tak ke liye Jai Hind, Jai Bharat.